Welcome, medical students, to today's lecture on the complex topic of acute mesenteric ischemia. In this comprehensive script, we will delve deep into the pathophysiology, diagnosis, management, complications, and prognosis of this condition. Acute mesenteric ischemia refers to the insufficient blood supply to the intestines, which can lead to severe consequences if not promptly recognized and treated. Acute mesenteric ischemia commonly occurs due to an abrupt interruption of blood flow to the mesenteric vasculature. The primary cause is often an embolus or a thrombus, leading to vascular occlusion. Other etiologies, such as mesenteric arterial spasms, low flow states, or chronic mesenteric ischemia exacerbations, may also contribute. The compromised blood flow leads to tissue hypoxia and subsequent endothelial dysfunction. This sets off a cascade of events: disruption of normal endothelial metabolism, release of vasoactive mediators, activation of coagulation cascades, and initiation of inflammatory responses. These mechanisms cumulatively lead to tissue injury, cellular damage, and, ultimately, intestinal ischemia. Embolic and thrombotic mesenteric ischemia have distinct clinical presentations and require precise differentiation. Risk factors and symptomatology guide diagnosis, with CTA and duplex ultrasonography aiding in accurate identification of underlying pathology. Accurate and timely diagnosis of acute mesenteric ischemia is pivotal for effective management. Various imaging modalities aid in establishing the diagnosis, assessing the extent of bowel involvement, and guiding treatment decisions. CTA is the gold standard non-invasive imaging technique for detecting mesenteric artery occlusions and vascular anatomical variations. It provides detailed information on the vasculature, highlighting the site, extent, and nature of the occlusion. Additionally, mesenteric duplex ultrasonography, which combines real-time visualization of the mesenteric arteries and Doppler flow measurements, complements CTA findings and helps identify patients who may benefit from endovascular interventions. Laboratory markers, such as lactate levels, D-dimer, and arterial blood gas analysis, are crucial for diagnosing and assessing the severity of acute mesenteric ischemia. These markers help guide treatment decisions and correlate with imaging findings for accurate diagnosis. Surgical management options for acute mesenteric ischemia involve embolectomy, thrombectomy, and revascularization procedures. The choice of technique depends on factors such as extent of involvement, bowel segment affected, and comorbidities. Early diagnosis and intervention improve outcomes and reduce complications and mortality risk. Endovascular interventions like percutaneous transluminal angioplasty, PTA, and stent placement are minimally invasive options to treat acute mesenteric ischemia. PTA dilates the blocked artery, while stent placement provides support. These techniques are used in certain cases, but complications exist, so patient selection is crucial. Acute mesenteric ischemia can result in severe complications if left untreated or if there is delayed intervention. Prolonged ischemia can lead to irreversible bowel necrosis, mesenteric infarction, and subsequent peritonitis. The management of complications involves a multidisciplinary approach. In cases of bowel necrosis or severe ischemic changes, surgical resection of the non-viable bowel may be required to prevent the development of systemic sepsis. Aggressive fluid resuscitation, broad-spectrum antibiotics, and early surgical consultation are crucial in curtailing morbidity and mortality associated with these complications. Medical management of acute mesenteric ischemia involves anticoagulation to prevent clot extension, vasodilator therapy to improve blood flow, and supportive care. Close monitoring and imaging are crucial for assessing the need for surgery. Acute mesenteric ischemia has high morbidity and mortality. Timely recognition and treatment are crucial. Prognostic factors include age, comorbidities, occlusion extent, and need for surgery. Advanced age, delayed presentation, bowel necrosis, and multi-organ failure worsen outcomes. Long-term outcomes depend on initial severity and blood flow restoration. Some develop chronic mesenteric ischemia or recurrent acute episodes. Regular follow-up, risk factor modification, and patient education are important. Ischemia reperfusion injury occurs when blood flow is restored to ischemic bowel, causing an inflammatory response that worsens tissue damage. It can lead to post-reperfusion syndrome, organ dysfunction, and respiratory distress. Treatment involves fluid resuscitation, monitoring for complications, and potential use of medications to reduce inflammation. Ongoing research is focused on finding new therapies. The diagnosis and management of acute mesenteric ischemia pose specific challenges in certain populations. Elderly individuals, for instance, may present with atypical symptoms and have multiple comorbidities that influence treatment decisions. In postoperative patients, early suspicion is crucial to prevent delayed diagnosis and improve outcomes. Underlying comorbidities, like cardiovascular disease or chronic kidney disease, may complicate the clinical picture and alter the management plan. Collaboration with specialists from various fields, tailored interventions, and close follow-up are imperative in ensuring optimal care. The field of acute mesenteric ischemia continues to witness advancements in understanding its pathophysiology and exploring innovative treatment modalities. Researchers are investigating the use of stem cell therapy to enhance tissue regeneration and promote recovery after revascularization procedures. Targeted molecular interventions, such as angiogenesis-promoting agents or anti-inflammatory drugs, hold promise in limiting tissue damage and preventing complications. Additionally, advancements in imaging techniques, such as functional imaging and endoscopic modalities, may offer non-invasive ways to assess bowel viability and guide treatment decisions. In conclusion, acute mesenteric ischemia requires prompt recognition, accurate diagnosis, and timely intervention. Management involves a multidisciplinary approach in addressing long-term outcomes. Continued research and emerging therapies offer hope for improved patient outcomes in the future.